go over how to turn your Ameda pump parts that go to the electric pump, the hospital pump or the Ameda Maya Joy, into the hand pump, which it comes with this little um, teal green piece that turns it into a hand pump. So the first thing I recommend, especially in the early days, the first day or two or three after delivery, is to remove the big bottle it comes with and replace it with one of these smaller graduate feed bottles. The reason for that is, especially in the hospital, is if mom does get some colostrum, this allows us to measure it more exactly, and it makes it easier to remove it if needed to give to baby. So it gives us more options versus the wider bottle that it'll just kind of coat the bottle and doesn't really go anywhere. So number one, change the bottle. Number two, you're also going to make sure that that little duck bill that's in there, that little valve is there when you screw the bottle back on. And then you're going to remove the cap and the diaphragm. You don't need these for the hand pump, so you're going to put those aside. The hand pump piece, the plunger goes in the top with the hole, the cutout, towards the flange. So plunger in, cut out towards the flange, and you're going to hook it on this little piece here, not down here, but up here, that first little ring. So I usually use my hand or I kind of use it against my body to hold these little sides because they like to pop off here, and then you kind of have a broken part. They don't go back together very well. And there you have your hand pump. So now when educating mom when to use it, a couple things in the early days where it might be helpful. One is if you are the baby struggling to latch, maybe mom has flat or inverted nipples, the hand pump will help to evert the nipple and give baby a little bit of something to kind of grab onto and get that suck reflex going so you can get a nice mouthful of tissue, not just skin or just the nipple. Two, if baby's struggling to latch or maybe we need to get some colostrum out or maybe baby's not able to latch for some reason, say baby's in NICU, and we need to get colostrum moving. The hand pump sometimes can remove the colostrum easier than the electric pump. So we might want to use it to get things moving in the beginning. Thirdly, it's a good tool for mom to have once she goes home because as her milk starts to transition, her engorgement phase happens somewhere in that 3 to 5 day range, she may get very tight and full, and that makes it harder for baby to latch if you have just a full breast with just the nipple and no movement to the tissue. So using the hand pump just to take a little bit off the top to soften up the areola area can sometimes help babies to latch better once that engorgement hits, especially if mom has a really robust supply or if she's gone a little bit too long without pumping or latching. So it can be a helpful tool for that as well. Some people also just like to use it for pumping, but it can be a lot of work, so most moms opt for the electric pump version. So there you have how to turn it into a hand pump. Now, how to use it, I have our little breast model here. So you're going to educate mom that you always want the nipple centered in the hole. This hole is much too big for this. See a video on nipple sizing for flange sizing for more information on that. But you're always going to make sure that the nipple's the right size, but then you're going to kind of come up and over so that nipple is centered in the center of the flange. Have mom hold with one hand, but not so tight that we're pushing the tissue in or kind of kicking that tissue back into her chest wall. You want that nice and flush so no air comes through, but not so tight that it's putting pressure on the tissue, kind of folding those ducts, because then it can prevent milk removal. So we don't want that. So nice and flush, nice and snug. And then with her other hand, she's going to pump here at the top, not down here because it's going to be very difficult. Gently at first, and you're going to do a quick kind of pump, pump, pump motion. If you're just doing this to evert the nipple, maybe 20 times or so. If we're doing it to collect colostrum, you may have to do it for several minutes. But that pump, pump, pump is what you want to start with. If you do start to see colostrum collecting down here in the chamber here, then you're going to kind of switch it to more of a pump, pump, and a hold. And then just kind of go with that motion, and that will help to bring down more colostrum. That extra suction pressure can help with that. It should not hurt, so if it's painful, either it's the wrong size and there's pulling too much tissue in, or she's doing it too hard. So just kind of lessen the grip on it. It can be very suctiony. So it's good to warn them ahead of time so that they don't go too hard too fast and then cause some nipple damage or tissue um, chafing or something that is uncomfortable from. So if you have any questions about how to use the hand pump, please don't hesitate to ask. It's definitely something that I usually recommend early on, especially if you have any of those challenging situations, and it's a good tool to have for anybody.